Hello, everyone, and welcome to the Flint Community Webinar, your community resource. We're so happy to be back with you, and we've got a great panel of people to talk to you today. But first, I want everyone to give a warm welcome to our guest MC, Dr. Esch is no stranger to the webinar and is going to help us today with the wonderful expertise we have today, and is going to be introducing everyone and helping you walk through all the knowledge. So thanks to Dr. Esch for being our wonderful MC and expertise for this afternoon.
So we have a lot of wonderful guests today joining us. Kicking it off, I am going to introduce our second year MSU medical students who are actually in my program, the Leadership in Medicine for the Underserved. We'll talk a little bit about that. And then we also have from the health department, Thelma, Michaela, and Joanne, who will be covering some local data in terms of TB and bird flu, which is what we will be talking about today. And then we will have Dr. Stephen Huang and Dr. Caitlin Learoff take it away and talk a little bit, do a little bit of a deeper dive for some of those topics. So I am going to stop sharing and we will kick this off. So welcome everyone. I want to introduce our first guests, Mary and Obadiah. They are two second-year medical students, so future doctors, who are in the program, the Leadership in Medicine for the Underserved, which is a certificate program here in Flint, where we train future doctors to be empathetic leaders for vulnerable populations. So I'm going to let them take it away. They're going to cover some basics in terms of tuberculosis and bird flu for you guys.
Thank you, Dr. Esch. So I'll go ahead and share my screen. Is that working? Okay. So like Dr. Esch said, Obadiah and I are just going to cover kind of some of the basics about TB. So what is TB? It is a disease. It's caused by a bacteria. I have the name on there, but you don't really need to know that. Typically, this bacteria is associated with attack on the lungs, which is why I think we see a lot of the classic TB signs, like that cough that people associate it with. But it can actually attack any part of your body, including the kidney, spine, and brain as well. Importantly, not everyone who has TB or is infected with TB becomes sick, which Obadiah is going to touch on more a little bit later. But you can actually be a carrier for it and have no symptoms. So in 2023, there were 9,633 cases of TB, which is one of the highest reported numbers since 2013, which is why we're talking about it today. It is a very serious condition if not treated. So it's really important that you come in and seek treatment as soon as possible. The kind of classic symptoms that, like I mentioned, we associate it with it are the lungs. So that cough, fever, and we often will see night sweats. So you'll wake up in the middle of the night and just be drenched in sweat. And those are kind of the typical things that we would see with TB. How is it transmitted? So TB spreads through the air. It's from person to person. When someone who is infected with TB is coughing, speaking, singing, anything that would allow droplets to get out into the air. Although it spreads in the same way as flu, like what we would typically associate it with, it's much less contagious. So importantly, in order to catch TB from someone, in order to become infected with it, you need a really prolonged exposure. The number that they usually cite is about 8 hours. So it's not super easy to catch, which is good for us. TB is not transmitted by some things that we might think it would be, sharing toothbrushes, saliva doesn't carry TB. Interacting with someone with TB alone isn't going to give you it. So if you just shake someone's hand or briefly encounter them, you're not going to get it from them. Like I said, you really need that prolonged exposure. So sharing a bathroom with someone or changing bed sheets, things like that, you're not going to get it. Same with sharing food, drink, or utensils. You're not going to catch TB from that. And then I will pass it to Obadiah to talk a little bit more about the different forms of infection.
Thank you, Mary. Appreciate that. So yeah, I'm going to be talking about latent versus active TB. We're going to try to make this interesting because I know this is science. It can sometimes be a little mundane or boring at times. So if I could direct your attention to the right before you read any of the words. So here we have a prisoner. He's being held by the police. He's in custody. He's in prison. Let's pretend this person is an individual such as a godfather, right? So high ranking, they can cause a lot of damage if they so choose to, but they've been captured, right? So they're not able to cause this or wreak havoc on society, all right? But on the bottom picture, we see maybe the godfather has escaped. He's run away for whatever reason. More than likely, the defenses surrounding the prison or the police officers were so engaged that the godfather had a little bit of time to kind of slip away. And when we think about active versus latent TB, this is exactly how it is. So in latent TB, first off, the bacterium is kind of asleep. And what's happened is that the immune system has ensheathed it, encapsulated it, kind of captured it in this own little prison to where it can't escape or cause any meaningful harm to the body. So the body's response is to control, but it doesn't eliminate it. And that's important when it comes to testing. Some of you all, maybe at your jobs, have had to undergo tuberculosis screening, and maybe that you had like a positive test. Oh my goodness, like, am I infectious? No, that just means you more than likely were experiencing a latent portion of this specific bacteria, meaning that you were asymptomatic, you didn't have any symptoms, you weren't contagious, but since it is inside of your body, it will test positive because it's in there, but it is protected. So the godfather is still in sheath. Now, if we move to the active phases of TB, this is analogous to what I was mentioning earlier. If someone comes and maybe distracts the prison guards, they attack the prison, the godfather can escape. And that's the same with active TB. When we have maybe a specific maybe virus such as HIV or AIDS that sufficiently engages the immune system to where it can no longer maintain all of its functions, then that tuberculosis has a chance to escape, that specific bacterium. So what we see in the mechanism is reactivation of that specific mycobacterium. And then the body's response is that it'll be injured. The lungs will be, you'll see like these cavitations on imaging. You don't need to know these aspects, but we will see damage in the lungs nonetheless. And then the clinical features are things that you maybe read about or heard, where you'll have like the fever, the night sweats, maybe like a bloody cough, things of that nature. And it can be contagious. Typically, individuals who have a positive active case of TB, the first thing is isolation. We got to isolate you. We got to get you away from other people. But then we'll start you on maybe a few months course of different antibiotics. Okay, Mary, you go to the next slide for me. All right, so now we're going to switch gears. So we just talked about a bacterium. Now we're going to talk about a virus. Okay, so we're talking about bird flu, and I don't know. I might be the youngest person in here, okay? So we're going to talk about bird flu for a little bit. I recognize I'm a second year med student. So with bird flu, let's think back to 2009. So I was in elementary school. Obama got elected 2008. I remember 2009, I was like maybe like 12 years old. He's talking about this thing called swine flu. And I'm like, what the heck is that? I'm like, what is swine flu? And he kept using this term H1N1. I was like, bro, what is H1N1? Right? So they're using all this terminology, and now that I'm in medical school, I've had the chance to kind of learn what he means by H1N1 and using names such as swine flu. So when Obama was talking about that in 2009, essentially the H and the N are things I'm going to break down here in a second, but those are the scientific classifications we use to kind of categorize something. However, we recognize not everyone's in science, so we have to assign a name to that specific scientific classification that's more understandable for the general public. So we'll call it something like swine flu or bird flu. In this case, bird flu, which is a subtype of influenza. Think about influenza as the parent, and then you have like all these different H and N combinations that are the children. What we see specifically is with bird flu, it is H5N1. Okay, so now that you understand like H and the N's are more so scientific names, the general name would be the bird flu, but they're the exact same thing. Okay, so with the H, specifically think if we have two pirate ships, right? They're on the ocean, and let's say one pirate ship wants to get to the other pirate ship, so they throw like a hook with a rope, and they try to pull in closer to the other pirate ship, that's what we call the H. That's called hemagglutinin inside the body. So it allows the virus to bind to the other cells so that it can start to invade and get inside and wreak havoc on that specific cell or that specific pirate ship. Now the N, I like to think about like the Trojan War, right? So we had like the I don't know if you all are very familiar with, but I'll break it down, give you a little bit of history. So during the Trojan War, we kind of wanted the enemy. They were trying to figure out how to get inside the city of Troy, and they couldn't get inside. I was like, man, how do we get in here? So they had this horse. They put soldiers inside the horse, and they presented it as a gift. It was a huge horse made of wood, and once the horse was brought in, the city of Troy was like, wow, this is a great gift, but they didn't know that there were soldiers inside that were going to wreak havoc on that city. And that's kind of how neuraminidase is. So whenever neuraminidase is activated, it allows the virus to exit and spread throughout the body, much like that Trojan horse being inside the city. So when we look at, I guess, H1 and N1, we now know that, okay, H is used for the cells to attach to our cells inside of our body. N is used to create that spread that we see throughout the body. And so the mechanism that we'll see with this is it's a respiratory virus. It infects your lungs. The body's response is that it has a pretty grave outcome. Fortunately, in the state of Michigan, 2024, there were only 2 reported cases of anyone having bird flu. And out of that specifically, there were dairy farmers who had contracted the virus specifically. And because of that, we recognize, okay, the likelihood of the public maybe being exposed to this or catching this isn't sufficiently likely by any means. And with the clinical features, you'll see like high fever, cough, difficulty breathing, things of that nature. But I know the question that most of you more than likely have is this question of transmission. Like, okay, can I buy eggs? Can I buy chicken? Can I buy milk? This is on nature. Yes, you can buy those without any overwhelming concern about contracting this specific virus. And according to experts, there was one Food and Disease Control out of Cornell, and then I think an infectious disease doctor out of Duke. They were talking and discussing that the likelihood of transmission from the public to, from chicken and cows to the public is very, very low. And they've also stated that just basic mechanisms of like using pasteurized milk, unless you're drinking from a cow directly, then you need to be wary of that. Or even with your eggs, make sure you're cooking your eggs, unless you're like some type of power lifter and you're just taking raw eggs or something. Just don't do that. But even with those things, they have acknowledged that those transmissions are very, very unlikely. So even with that, we would like to take the time that although we don't have an acting vaccine that is effective for bird flu specifically, we would like to encourage you to get your annual flu vaccine to protect from other viruses, specifically influenza, that might cause or might put you in a precarious situation, or maybe get you sick around your kids and things of that nature. So with that, I hope you all enjoyed the basics of learning about TB and bird flu, and we'll let the rest of the team take it from here.
Thank you so much for that introduction, Mary and Obadiah. I think that was a wonderful intro into the subjects we'll talk about today. I'm going to second that. We are seeing an influenza, specifically flu A surge right now. I'm working in the hospital. It is not too late to get your flu vaccine. So encourage your peers, encourage everyone around you to get their flu shot. So with that, I am going to turn it over to Dr. Huang and then to Joanne, Michaela, and Thelma, so they can give us a little bit more context in terms of tuberculosis. So Dr. Huang, anything to add to this wonderful introduction?
Yeah, I thought that introduction was outstanding, and I think the illustrations and the analogy were really spot on. The prisoner and kind of escaping the immune system is a really good analogy for tuberculosis. I don't have any slides, but I'll just kind of talk pretty freely. Just about tuberculosis. I think, a lot of people have heard about tuberculosis. It's a pretty considered often old disease. It used to, we thought, oh yeah, TB was pretty prevalent, but doesn't seem to be as prevalent now. And that is the case, but it still is around. So TB it used to be pretty highly prevalent in the United States, as the United States kind of just became more industrialized, and we just improved our hygiene just in all areas. rates of TB have decreased, but it hasn't gone to zero. And so the reason why we're bringing it up, in this webinar today is that there are cases that occur all the time of TB, and there are even outbreaks and pockets of outbreaks because of how transmissible it is. Even though it requires, some contact for a while, a lot of times people don't know they don't know they have TB because the symptoms can be kind of subtle for a while. And so the most common concerns are sometimes your family members or close contacts who you've been living with for a long time. So if people get diagnosed with TB, sometimes we'll often have to test the other family members that they live with. Most departments of public health are outstanding at really, once we identify a case of TB, there's nurses, the clinics are really outstanding at getting patients, A, the medications, and B, screening and looking at it in other family members. It's still, even though it may not be as prevalent in the United States, as I mentioned, it still occurs. It still affects, sometimes, unfortunately, some of our, we often say kind of maybe our vulnerable populations, patients who are older, children, patients who, people who might not just have, the financial means, people who, sometimes homeless, if they're going to homeless shelters and they end up spreading it. So sometimes shelters can have a lot of cases of TB. And so it's still really an important disease. And it actually ends up being still probably one of the top #1 killers in the world. So we see a lot of it in other countries like Asia and India. And it's really all over all over the world. And people, visit from other places. So that's also a big source of where TB can spread. We're a mobile world these days. And so TB kind of spreads to it. So it affects everyone. And these are just kind of things to kind of be aware of.
Thank you so much for that deeper dive. So I know I've been seeing tuberculosis a lot more in the news lately. I know that there was a case in Kalamazoo recently, so pretty, maybe not super close, but within the state. I'm hoping that we can have maybe our health department friends join on and talk about sort of the context for some of this, specifically perhaps in the area, Genesee County, or if there's anything else you guys want to add.
Velma, do you want to take over?
I think you're muted.
Can you hear me now? All right. The only thing that I was going to add was that our numbers, yes, Kalamazoo did have a case. But as far as our numbers, we are not expanding. Our case rate is pretty much the same as it was last year. For per 100,000, we had in 2003, we actually had 11 cases in Genesee County compared to 149 for the state of Michigan. This in 2024, we had 10. So our cases are still the same. So we are just still monitoring and surveying people that's coming into the country. And that's how we're keeping an eye on what's going on in the state, in our county here.
Awesome. I don't know if this would be a question from anyone out there in terms of participants, but do you guys want to comment on, like, is there a vaccine? Is there a way that we can prevent? Are there certain things we can do? Do you guys want to talk about that a little bit?
Sure. Yeah. There are some countries try to use because of, especially in cases where TB is pretty high, they've tried to use vaccines, and they've had some success with those vaccines. In the United States, we found that since TB rates have come down quite a bit, it's not routine. Vaccines for TB are not kind of routinely used. They're not as effective as some of our other vaccines. So, people who get a little vaccine fatigue, there's the doctors and research kind of always look at every vaccine as a little bit different. And, the vaccines that are often used and encouraged a lot are because they have a lot of good data for them. The vaccines for TB, especially in the United States, are just not as routinely adopted. But instead, we screen. So people who are at high risk for people who might be exposed to TB, we may, people often think about skin testing for TB. So they actually just put a little needle prick under your skin, and then in 48 hours, they look to see if there's a reaction, and that would indicate whether you've been exposed to TB. There's actually now blood testing that's, I would say, even a little better, because the downside of the skin testing is that you have to come back in 48 hours and have somebody look at it, whereas the blood test is a one-time blood test, and then the lab will look and say if you've been exposed. These tests just simply tell you if you've been exposed to TB. It doesn't tell you if you've, as Dr. Obadiah mentioned, that you could either be active or either sick or not so sick. So these tests just tell you if you've been exposed. And then it's really kind of up to your doctor. I would talk to your doctor about if you have any symptoms, and they'll determine whether you need to be treated. Sometimes it could just be one drug for several months, for a couple months. If you have more active disease, then we usually want to be a little more aggressive with multiple antibiotics.
Yeah, I would add here, thank you. Everybody's added so much. So I'm not sure exactly, any specific questions I would be happy to ask, especially from the audience. But I would add that there is a vaccine called the BCG vaccine that's given in a lot of developing countries that have really high rates of tuberculosis. This vaccine is usually given primarily to babies to prevent what's called disseminated tuberculosis, which is when it gets kind of all over the body and is not just in the lungs. And it really only works for about 5 years. So this is a really important point. A lot of times, if you're talking to people that come from countries who have gotten the tuberculosis vaccine when they were babies, they might think that they have long-term immunity. And the truth is they do not. That really only works, like I said, for, those years when the rates of death from TB are really high in babies. I would also add that TB, I know Obadiah did a great job, but TB does still pose risk to some populations more than others. Definitely those that have any sort of lowered immune system for whatever reason, whether that's HIV, being on chemotherapy, being on other steroids or other immunosuppressing drugs, or if they are very young or much older, then those are also high risk groups for tuberculosis. And the other thing I want to add is that the only reason that TB, and also that we are doing such a good job at trying to monitor avian influenza, is because of our public health departments and all of the work that they do in contact tracing and testing and isolating. And so I know there's a lot going on politically right now, but some of these things are really apolitical issues in that, we need a robust public health system in order to maintain all of the good work that we've done in these diseases. Just like Dr. Huang said, TB is the #1 cause of infectious disease death worldwide. Some people think it's COVID, but it's not. It's actually tuberculosis, and it's a real I think it's a real statement of how effective our public health system has been, in that we've been able to, like Thelma said, had 10 cases last year. I would say, though, that that's not insignificant. If you look at the case rate in Genesee County, it is still higher per 100,000 people than other places in Michigan. And I would also say that if we don't maintain the public health measures that we do currently practice, the cases will go up. So this is not to say that, we've conquered TB, or, we've conquered any infectious disease. It's only because of the passionate, committed work of our public health servants that often do their work against great odds, and that they continue to contact and isolate and treat these people, often at minimal or no cost. So I just want to say thank you, because I know I work with you guys every day, and I'm always in awe at, what you do for very little thanks. So there is a question about how long isolation is necessary. So I would say, do you want to answer that, Thelma? I saw you move your hand or.
Well, you can answer it.
Okay, no, I mean, so this is actually a little bit of a moving target. You know, if somebody has pulmonary TB, we always used to say that if as long as they're on treatment for at least 2 weeks, that they're not really infectious to other people. Honestly, sometimes that can be a little bit of a moving target depending on how much TB the person has. You know, if they have big, cavities in their lungs and their bacterial load is really high, the conversation might be different. But usually we actually, from the medical clinical side, defer to the health department for, when they're cleared. So if Thelma wants to jump in on that, please be my guest.
I was just going to say, they've just come out with a study, and now instead of 2 weeks, they're saying if someone has been on treatment for active tuberculosis for 5 days, that's when
That's
the
great. I'm
disease
glad
That's
to
new. Yeah.
burden.
That's good news. Okay.
Yes, the disease burden is much less. So it has to be exactly 5 days. It can't be 4 or anything like that. It should be 5 days. And then again, it depends on the case and the disease burden as well, as will it be the 5 days versus the 2 weeks. And a lot of it is because we don't want to have anyone, I'm thinking of isolation. That can cause problems because everyone doesn't want to just be isolated. They want to know why they can't go out. So that's when they came back and started studying the disease. When do the disease decrease in someone's body? And they found out that after 5 days of being on treatment for active tuberculosis, greatly diminishes that spread. So that's a good thing that we've seen come out.
That's wonderful. I was talking to some of my medical students recently about TB, and just talking about how it truly, I'm going to second what Dr. Leroff said, that truly it is a great example of how amazing public health is in our public health efforts, because not only do we track it very closely, we also oftentimes, I believe in the adult world, but I know in the peds world, have people go out, make sure that patients are taking medications, so you eliminate issues like transportation and access to medication. Truly, the way that we manage or tuberculosis is such a good example of through and through public health. And so I think I'm going to second what Dr. Leroff said, that this is truly important for medicine. Thank you, everyone. So in terms of, I just kind of want to ask a little bit deeper in terms of prevention, protection, getting tested. Based on what we've heard from all of our wonderful experts, it sounds like tuberculosis is not this like imminent concern. You have to be around someone for quite some time, really close contact, not something that's very, very prevalent in this area, even if rates are a little bit higher than other places. So what would you recommend to our participants who are listening in terms of prevention, protection, their loved ones, stuff like that?
For tuberculosis, Dr. Esch, or for avian influenza specifically?
We're going to talk about tuberculosis right now, and then we're going to shift over to avian influenza. Yeah.
I would say,
yeah, I mean, yeah, I'm sorry, Dr. Huang, please go ahead. Oh, I was just going to say, I think the important thing is, well, several things. One is that to follow the health department's recommendations is really, I think, the, most effective thing you can do. The isolation period that they recommend is very important to stop the spread, to follow if you are testing positive for that latent or sleeping form of tuberculosis where you've been exposed but don't have active symptoms, you're really not infectious. And I think that that's an important thing to get across. I see a lot of consultations where people feel like they've been given this diagnosis and they're scared that they're going to harm their families. And, there's still a lot of stigma associated with TB. And so I would say that if you have the active disease with symptoms, follow what the health department says, and you're going to be fine, that 5 days or 2 weeks or whatever. And then if you have the latent or sleeping form of the disease, you're not infectious to other people. So you should still follow the recommendations about treatment, but also, rest assured you're not making your family sick. You can cook for them, you can hug them, you can kiss them, it's not a scarlet letter to have TB or latent TB. It's just about making sure that you get treatment.
Correct. So you're not spreading the disease to others. I just wanted to piggyback. In doing or investigating some of the cases, someone can get a positive blood test, and their doctor would just say, well, that's it. Well, from the health department standpoint, we want to see that x-ray. The x-ray is going to let us know, as well as a sputum sample, it's going to let us know if this person actually has active disease. So if you have a positive blood test, but a negative x-ray, now you're looking at the sleeping version of the tuberculosis. So you're not causing any kind of infection or any issues for the community. Versus if you get that positive blood test, now you may have a cough but wasn't thinking about it, but you get a chest x-ray, and then your upper right lobe, you notice that there's some kind of encapsulation. So now we got to do even further testing. It's just what I've been seeing is someone just get the blood test and then that's it. No, it goes more than just that one blood test. If you're actually checking someone to make sure that they don't have active tuberculosis.
So Thelma, if
just-
somebody does have active tuberculosis, what is the role of the health department? Can you explain a little bit about what you do beyond confirming that?
Well, if someone have active tuberculosis, what we will do after we get the chest x-ray is we're going to decide where have this person been, where do they work? Because what we call it is you're going to test out of their circle. So you want to get everyone that they were in close contact with. If they work, you want to know where they work at, because now you got to check those people. If anyone comes back positive, now you got to check. It's like it just gets bigger and bigger because you want to make sure that you're containing it as much as possible. If someone has all of that, we here at the health department, we will provide treatment. If someone needs to go on medication, we provide the treatment for them. We monitor and manage that case until they're completely cleared to go, then they're no longer a threat to the community. So that's what we do here at the health department. If they need medication, we'll ensure that they can get their medication. Whatever they need. If we put them out in their active disease, we assist that patient with anything that they may need. If they need food, we try to have resources available for them to get food. If they need help with shelter, we're helping them get shelter, whatever they need, because it's us that's putting them out of the public, so they're not spreading it. So that means we're going to try to take care and provide as many resources to keep them, because stress, you look at if you have someone with TB and they are the only provider for their family, now that's a whole different worry that they have. So we try to take some of that burden off of them while they're in treatment with us here. And then when they're done, we do give them a letter to state that they've been treated and they've been cleared. And we also let them know to keep a copy of it. I tell them to take a picture on their phone, just keep a copy, because once they've had a positive test, they will always have a positive test.
Thank you so much. Yeah.
I'll just also add, in terms of diagnosis and treatment, it's important to get treated. So even though there are many good treatments for TB, so you want to be treated because there are many good antibiotics for it, but there are sometimes resistance patterns. So another huge role that the public health plays is to actually make sure that they can see what type of tuberculosis it is and to see if it might be resistant to certain antibiotics. And they really can help manage that and make sure that they find the right antibiotics to use. And in fact, as a lung doctor, most of us, we just defer to the public health department to really identify what the best TB regimen should be. In terms of the latent disease, where we say it's kind of less active, it's also important to treat that too. And the reason, you might say, well, if I'm asymptomatic, well, why do I need to treat it? The reason is because your risk of developing more active disease is higher if it's not treated. So especially if you've had a recent exposure but then you don't have any symptoms and you're like, hey, I feel fine and I don't have any symptoms. But if you have a recent identification that you've been exposed and you might have this latent condition, by treating it early, it'll help prevent you from developing reactivation of TB later in life. So
Yeah.
treating it early is really kind of important as well.
Thank
Yeah,
you so much. And you kind of touched on I was going to ask, so not everyone needs to get tested. It's a matter of if you've been exposed, and generally speaking, you will find out through the health department. So through and through a truly public health situation. I'm going to shift gears over to avian influenza. So while we still have a little bit of time, I know Dr. Liroff, I think you were asked to kind of provide us a little bit deeper dive into that. But I still want to keep Dr. Huang on and Joanne, for any input. And so do you want to give us a little deeper dive into avian influenza, please?
Yeah, absolutely. Again, Obadiah and Mary did such a good job at the beginning, kind of doing the basic science of it. So as I said, if there's any specific questions that people are wondering in the audience, please put them in the chat and I'm more than happy to answer them. But just a couple things. First, I want to talk about influenza A, which is H1N1. And I want to say that, we in Michigan and in the country are seeing a second spike of the virus. There was we thought the peak was actually in late December, early January, and then the cases went down and they've gone up again. So we in the country are actually seeing the most influenza cases since 2009, which was swine flu. So I want to emphasize that just the regular flu, this is just influenza A, H1N1, can cause very severe disease. And we're seeing a lot of really sick people in the hospital. And so, this is just something that every year we talk about. I know people hear a lot about the flu and because we hear so much about it, maybe you kind of write it off, but the flu is a major cause of pulmonary death in winter months and people missing work, people getting very sick. And so I think it's really important as we talk about avian influenza, which I will talk about, but not to diminish how important it is for people to get their flu vaccines. The flu vaccine is not perfect. I am the first to admit that, but even if you get the flu vaccine and then get the flu, you have a less severe case of influenza than you would had you not gotten the vaccine. So I like to try to encourage everybody. A lot of people rightly say, well, I've gotten the vaccine and I've gotten the flu. And that's true. That happens. I'm not going to lie to anybody. But if you get the vaccine, you're less likely to have the really, really severe outcomes with influenza. So please, everybody get vaccinated. There's still time. And this year, it does seem like it's a virus that's causing a lot of severe symptoms and more severe disease than we've seen in a couple years. So
I can say we're seeing it in Peds World too. So in the kids are getting it. Kids are getting very sick from it. We have had, maybe Joanne and Michaela can touch on this, but we have had a death in Genesee County, a child from influenza. And I always like to mention, I get my flu shot, my husband gets his flu shot, and my kids get their flu shot too. So I practice what I preach. I'm sure we all do.
Yes, absolutely. Yeah, that was very sad and very sobering to hear that, Genesee County, we've had one of the first identified pediatric deaths of associated with influenza. It's awful. It's just awful. But yes, I also practice what we preach. I am the flu shot enforcer of my family as well. So we got to do it. Even if you haven't done it yet, it's not too late. We got them at the health department. Give us a call, walk in. We're happy to get you anytime.
Yeah. No, absolutely. And so I'll just talk a little bit. Some of this is kind of getting in the weeds of the science of it, but it does relate to influenza A. So as Obadiah talked about, the flus are they're annotated by a letter and a number. And so a lot of what that has to do with is the way that the flu genetics are. The flu virus has what's called segmented genome. So it has these like little strands of DNA in its nucleus of the cells. And so, or sorry, not in the nucleus, but in the viral machinery. So every year when we are making the flu vaccine, we look at like what the the most common strains are in South America. And we kind of estimate, how do we think those are going to rearrange, and how can we anticipate a vaccine that's going to help protect people this coming year? And so the flu vaccines are a guess in a lot of ways. We make our best guess of how those genes are going to rearrange. But because of that type of genome, when there are other flus going around, there's the risk that if a person gets both flus at the same time, that the viruses could kind of share genetics and then create a more transmissible virus. So right now, avian influenza is not a very common infection at all in humans. I was reading, I think there's been 68 cases, maybe a little more now, but in the whole United States in humans. And so these cases have largely been direct results of people in contact with poultry or cattle or other animals. What is concerning about the avian influenza is that we are finding it in a lot of animals right now. It's been found in a lot of cattle. It's been found in a lot of birds. There's a very hardworking bird surveillance team in Michigan that goes all throughout the state and tests, birds to see if, especially dead birds, to see if they've had this virus. And so we are finding it. It is in the state, even though it's not commonly infecting humans. And so what I would say, though, is that they are finding that the virus is even going into domesticated animals. And the risk is really in eating raw meat or unpasteurized milk, which is actually a concern because there is kind of a group of people that believe raw milk has a lot of health benefits. So this sounds a little silly, but people are buying and drinking unpasteurized milk. So it is something to monitor for. That being said, as far as what you can do to keep yourself safe, eat cooked meat and drink pasteurized milk, and you'll really be doing a good job. I also would say that if you have pets, I would caution against giving your pets raw meat or any sort of food preparations containing raw meat, because that's how they are finding transmission of it in domesticated animals. The concern when it's so widespread in animals, again, is that even though right now, the virus isn't very good at going from person to person, should someone get infected with both the regular influenza A plus this, more dangerous influenza A that's in animals, then they could rearrange and create a virus that we don't have good immunity to that's really good at infecting people. And so it's another thing that is a concern, especially as our public health funding is getting cut and, we're decreasing the amount of surveillance we're doing because of funding cuts. We really need to keep ramping this up because it's far from over. The other thing that's a little bit challenging about highly pathogenic influenza or H5N1 bird flu, whatever you want to call it, is that it's not as predictable. So influenza A, the H1N1 that we get every year, that one has certain seasonal trends that we can anticipate, but this other influenza doesn't really. So it's something that we have to continue to offer surveillance for all year round. And if the numbers of this go up, it increases the likelihood that someone could get that co-infection and that the virus could change in such a way that it's better at jumping from animals to humans or from humans to humans. One of the issues is when viruses get really, really common, they have more opportunities to reproduce. And every time they reproduce, there's the possibility that it could change in a way that it makes it better at infecting humans or other features that could be concerning. And so just having widespread viral activity raises that issue as well, which is why even when these viruses aren't infecting humans, there's still a lot of surveillance and monitoring that's done about them. And so I got another question about how concerned should we be due to the confirmation of RFK Jr.'s appointment? That's a hard question. I think very concerned. I know Dr. Esch can probably speak to this as well as a pediatrician, but there's a lot of vaccine hesitancy. And I think it's really scary because vaccines are, in my opinion, one of the most effective scientific things we've ever had. I mean, you look at the HPV vaccine and that decreases the risk of cervical cancer if you get it by 90+%. It's incredible to stop cancer, to stop disease before it ever happens. And so I think we should be concerned mainly because he's head of an organization that he's spreading doubt into. And I'm not trying to get overtly political, but I think if you can't trust your healthcare providers and your public health institutions, it's just a really dangerous thing. So the most we can do is try to be available if anybody has any questions. I think it's always important to be informed, and it's not wrong to have questions about vaccines or to have questions about your health. But just try to find someone you can talk to and trust to get, updated information is what I would say. I'm not sure if anybody else wants to add to that.
I'm just gonna touch on this. Oh, sorry. That's okay. You go ahead, Joanne.
Oh, you're fine. I was just gonna
Michaela.
second that exactly. We know that people like us, we're the true experts in these topics, right? We've been educated on this. We've spent our lives and our careers learning and knowing and believing in this information because it is true, and we have seen the public health impact of what vaccines can do for people. Yeah, and I know it's not always the most glamorous, but just that, that doubling down of, we know that this is true and this is scientifically accurate, and we're going to continue to just forge on this path, regardless of, who we have in charge of such and such, organization. And yeah, I loved what you said, Dr. Laroff, about, finding someone you can trust. We know we all have trusted people in certain, you know, areas. We just like we do with like our cars, right? I have a mechanic that, if my mechanic told me my car would run better if I stood on my head for, a minute every day, I would do that. There are doctors and public health professionals that we all know, we trust them with our lives, and just continuing to be, those people and those resources is, I think, exactly we need to do at this point.
I think oh, sorry.
Go ahead. I was going to say, just because someone is hesitant doesn't mean that they're resistant. So don't give up.
Yes.
You are that, all of you on this call. Aurora, I know this was your question, but all of you are trusted sources. And this is a time we need to step up versus stepping back in our advocacy and education.
And
we need to push back against the misinformation.
Yeah, it's worth noting that the purpose of this webinar was to accomplish exactly that, right? Like this webinar came to fruition in the middle of COVID when there was a little bit of an information vacuum. Things were happening really quickly, and it felt important to bring you credible sources of information that where you could ask questions and you could get your questions answered. And so our goal, the people on this webinar are here for a reason. They are experts in their fields. You have an expert pediatrician and public health expert. You have an expert pulmonologist. You have the health department in your county here. You have an infectious disease specialist. These are people, as Michaela said, who have spent their lives learning this in order to bring you trusted information. We don't bring you people who, dabble, right? Like I'm not talking today because I dabble. I'm a family doctor. I go to Dr. Laroff and I say, what are the recommendations? I go to, the public health department and I say, okay, what are the vaccine updates? I go to them so that I get my information. The other piece that we haven't quite touched on is the real concern relative to vaccines is a lot of these illnesses are things that we are not used to treating, right?
That's what I was going to mention.
It's not the thing. I don't see measles every day. I know what it looks like because I've read about it. I know how to treat it in theory, but I don't even know if our hospital has the medication stocked to treat them. And so not only is it a problem of, the vaccine, the preventative aspect, but you have a generation of clinicians who have not seen these diseases in real time and will struggle, at least initially, to figure these things out. Very much like in COVID, we hadn't seen COVID. We were calling each other. We were on different networks trying to figure this out. And very early, we were hearing different things and we were trying to figure it out. These are things that we just haven't seen.
Yes, all of the attendings who trained me had seen some of these things, but hadn't seen it for decades. I myself, haven't seen a lot of these things in residency. The people who I train now have not. And so I think that's another major concern is that if there's more misinformation and lack of vaccination, we're going to start seeing some pretty terrible diseases in our midst. I will comment, though, that majority of people still do vaccinate. And so, I think that we need to touch on the positivity and continue to grow that, continue to encourage people I used to shy away from it, but now I tell every single parent that my kids are fully immunized. They follow the immunization schedule. I believe in vaccines. I believe in it so much that I protect my children with it. And I think that is a very, very powerful message that everyone here can spread as well. And Michaela mentioned we are experts, but parents are also experts in their kids. And I remind parents that you are the expert for your child. And the best thing you can do as an expert for your child is protect them. There's so little that we can control as parents. My own daughter had a pretty severe reaction to an immunization when she was a baby. I still vaccinate her. I still follow the schedule because I am the expert for her. And I think that's just the most powerful message you can spread when you do hear misinformation. Thank you for asking that question. That was a super important question.
Can I just add one more thing, Dr. Ash? I don't mean to monopolize. I just wanted to make one more statement. I also want to say it's not crazy to be skeptical these days. I mean, I know that there's been so much, with the pandemic, there's been so much loss of faith in public institutions and so much confusion. And so, I think that people are really concerned and they want to do the best for themselves and their families. And so I always want to make the point. I know we live in a polarized atmosphere, but it's not crazy to want your family to be healthy, to not want to hurt your children. And so if you have questions, please ask us. Like, please, I want all of this to be, an ongoing conversation. It's okay to have questions. It's okay to be skeptical, but get the information that you need from good sources so that you can make the best decisions. And absolutely, I fully admit science is a changing field. Every day we learn new things. So it is it is confusing when you want to get the absolute, up-to-date information in the field of science that will change. And so I think there also has to be understanding from both sides that we're all doing the best we can, and that the most that I can promise is that I'll try to give you the best information and never lie to you. And so if you have questions, I know all of the people on this call, but also please ask your providers. If a provider is ever abrasive or dismissive or, not listening to your concerns, then talk to someone who will listen, because, there is good information out there and we can help.
Thank you. I really appreciate you adding that. We only have about 9-ish minutes left. So I kind of wanted to see if Joanne and Michaela wanted to touch on anything in terms of local numbers, local things for flu or anything else.
Yeah, I can kind of just talk a little bit and just kind of echo what other folks have already said. Like Dr. LaRoff said, the burden of influenza A right now in our community, in Genesee County, across the whole state, across the whole country, it is skyrocketing. So take care of yourselves, stay home when you're sick. I know that is challenging, especially for some folks' work situations. But the best you can when you're ill, stay home. But it's back to basics, right? Rest, take care of yourself, these types of things. We are seeing a lot of flu right now, especially in school age children. I know I've had a lot of schools calling me lately being like, I like half of our second graders are out with flu. Is this normal? And I said, well, not necessarily normal, but this is what we're seeing right now. So, a lot of that going around. As far as I did just want to touch on real quick, avian influenza. There has been one avian influenza associated death in humans thus far, and I believe that was in the state of Louisiana, which is awful. However, that does coincide, there's been one death so far. The risk to the general public, again, like folks have said, remains very low. Um, I did just want to mention while we're here, if anyone ever, you see, you have a backyard flock, your flock is acting strangely, one of your birds dies, if you will. It's very easy, like a quick Google, who do I call if I suspect a bird with influenza? It will take you to an MDARD number in the US, and that'll come up very quickly within your first Google search. So if anyone does ever need that, it's quick and easy to find. And when you call them, they will walk you through what to do, next steps, if you will. So if anyone needs that, like I said, very quick Google search. And Sorry, I'm just checking my notes here, make sure I didn't miss anything that anyone else hadn't covered yet. Michigan, oh, I was gonna add, Michigan has seen between January 11th and February 10th of 2025, there have been 19 detections of H5N1 in wild birds. Just in case anyone is interested in the numbers. We have had 2 exposures, like exposure sources identified for humans in Michigan. Both of those have been in commercial agriculture, related operations to dairy cows. So, and 2 exposures, that's pretty low compared to some of the other states. There's been, many more in other states that have, higher populations and what have you. Like California, for example, I think has had upwards of almost 40 exposures. So relative to that, we've had a low number in Michigan, which I am happy to report.
And none
a
in
lot-
Genesee County, right, Michaela?
It's not that I know of. The surveillance at this level with what's going on is more taking place at a state level versus county level. So there's not a ton to report on like this very localized level, which is good, right? We'd know about it. That would be really coming out in the news a lot. So no news is good news as far as that for right now. But yeah, none that I know of, none of the exposures have been in Genesee County as far as like the commercial level exposures to the best of my knowledge at this time. But that was all I had to add. I can pass it off to Joanne or Thelma, anyone else, anything from the health department.
No, I would just say we are available to the physician community. You can always reach out to our CD department, our EPI department, any of us. In terms of vaccination, we're readily available. And I know, Aurora, you have in the chat a question about working with the community and you're concerned about undocumented individuals and their fear of seeking health care. And I'm sure if they're afraid to see healthcare in offices, the same thing would happen in urgent care and emergency services as well. And I don't know if anybody wants to answer that question, but we will work in partnership at the health department to make sure our entire community is well taken care of. I know that when COVID vaccines first came out, and Aurora, you were our partner at many locations. There was no questions asked about documentation or proving documentation status ever. So that continues on.
It is very rare for almost never for a physician provider to ask that. I take care of all kids. Bottom line, I take care of all kids. And maybe that's the message we send to people, to undocumented people in our community, is that we take care of all kids, all adults. I'm a pediatrician, sorry, but all kids and all adults. Thank you for that. Dr. Uphold wanted me to end this with a little blurb about what we would recommend you have in your cabinet. I don't know if Dr. Huang and Dr. Lear want to join me in this. From a pediatrician standpoint, during flu and cold season, she wanted me to tell you what I have in my cabinet for my kids. So I always have Tylenol and ibuprofen. I always tell parents fevers are not scary. They're a really good thing. My 3-year-old knows that fevers are the body's natural way to heal. But fevers make you cranky. And so ibuprofen and Tylenol or Motrin or acetaminophen. I generally speaking ask my pediatrician for an anti-vomiting medication at the beginning of the winter season because it's hard when your kids are vomiting. So talk to your pediatrician to see if that's something, if they are vomiting, if they're nauseous, if that's something that they would recommend. I have a humidifier in each of my kids' rooms that I run all night long when they're sick on full blast. I like the steam from showers. And then we have saline. So nasal saline that we spray into their little nostrils to get all the snots out. My kids are too old to be suctioned now, but if you have a little baby, a nose Frida or just a good old bulb suction work just fine to get all those snots out. So that's my standpoint for kids when they get sick. Do you have anything else to add, Dr. Huang?
I also make sure I have a working thermometer. and that sometimes
Of
doesn't
course,
always work,
yes.
or sometimes I lose the the batteries are old. So
Yep.
it's always good to kind of just make sure that it's working, and thermometers sometimes can be a little bit not always completely 100% accurate because now we got forehead and different ears, but knowing where your baseline is, so even if it's like 1 degree lower than kind of other thermometers, but it's kind of that's where it is baseline, you'll know like if it kind of hits 99, oh that's like good 1 degree higher than where it is baseline, so you kind of get that sense. And then I still have COVID test kits, and they don't always expire exactly at that date. The government says you can kind of look and see. Just because, yeah, when you do get like that viral illness, it's good to just kind of know that there is still medicines, especially for certain high risk patients. Paxlovid sometimes is prescribed, and sometimes I just want to know, is it COVID or is it flu or is it just some other common cold? And even if it doesn't change too much, I just still find it nice to know.
They have the rapid flu test at home, which we used very recently for my son. So yeah, definitely something. They're treatable. Flu is especially treatable in kids depending on age and, history. So
adults, there's, Tamiflu that we prescribe.
Yep.
Yeah.
Yep. Awesome. Thank you so much to everyone who joined us. I really appreciate it. Thanks for a wonderful conversation. We will be back in March talking about kidney and heart health. Thank you.